Welcome back to California Live. It affects millions of Americans, especially women. Melasma is a common skin condition that causes stubborn dark patches and discoloration that can be frustrating and often difficult to treat. Our very own California Live correspondent Amber Pfister knows that reality firsthand. She's live in Manhattan Beach with a board-certified dermatologist to break down what causes melasma and how people can better manage it. Now, Amber, I want to know how old you were when this all began.
Oh, Jess, I was way too young. I have basically been trying to manage my melasma for the past pretty much 25 years. So I had it when I was a teen, into my pregnancies, now as a 43-year-old woman. And I hate it so much. And that's why I'm here with Dr. Ablon, because I know that you have to manage this for a lot of your patients. So let's talk first. What is melasma? Is it sunspots? Is it hyperpigmentation?
You're not going to like it.
What is it?
You're not going to like it. Chronic, relapsing pigmentary disorder, hyperpigmentation. So it's not something that we cure, but the great news is we have so many different options. There are so many things we can do. First, I always like to pull out my little woods lamp, which is an ultraviolet black light. Ooh. And you can scan the skin in the dark, and it will show me kind of how deep your melasma is, which will tell me which way we're going to do the treatment.
Yeah, so I love that you have a light, so you can really tell, like, okay, what that patient needs.
Superficial, deep.
Why is it, I feel like more women have melasma than men. Yes. Why is that?
It is true. It is more common in women. Okay. It's more common in darker skin types, 3 through 6, but anyone can have it. And we don't say it's a direct trait that you get from your family, but it is more inherent in patients that have family history. So if you have, like, usually if you have a family history of like 33 to 50% will have melasma as well.
Oh, lovely. I'll have to thank one of my relatives for that one. I want to talk too about, for a while, I thought it was just the sun that caused melasma, but there's a lot of things other than just the sun.
So first of all, it is a pigment disorder, but it's a vascular disorder, it's an inflammatory disorder, and it has a dermal or deeper component.
Oh, lovely.
And ultraviolet light, absolutely one of the worst, but so is heat. And now we're finding out that visible light and blue light, so your phones,
even your phone,
and your computers can also contribute to it.
So you're telling me, like, hot showers and my phone, the things that I enjoy sometimes in life, can also cause that?
Wear sunscreen. Wear sunscreen kind of everywhere except in the shower, but wear sunscreen wherever you can. That's big.
So what are some of the products that can help at least manage it?
So I depending on the skin, depending on the patient, I'll choose different things. So this one has tranexamic acid in it. This has histamine. This has a combination of acids and tranexamic acid. And this has hydroquinone and retinoic acid. So depending on the skin type, depending on the level of disorders, we'll determine which product, and sometimes more than one, that I'll put the patient on. And if that's not enough, we've got the fun thulium laser.
Big guns. Now here's the thing, I've done a ton of lasers, and sometimes even a laser can flare this up, but this is brand new. Tell me about this.
This is new. This is a 1927 thulium laser, and it works in a little bit different way. It really does target those pigment cells, and there's very little heat generated when you're using it for melasma. So it has transformed my melasma practice. And my 67-year-old assistant, who has horrible melasma, this is the first time she's almost clear after one session.
Okay, you are giving me hope. For someone who's had this for 25 years, you're giving me hope. I want to talk about sunscreen really quick, because you had mentioned, you know, always wear your sunscreen. But there's, for someone who struggles with melasma, what should we be wearing?
So there are two typical types of sunscreen. There's chemical and physical. If you use a chemical one, you got to remember, you put it on the skin. That's typically avobenzone. It takes 20 minutes to activate. So if you put it on and then go outside, you're going to be exposed. So you just need to know, and that's why I do prefer the zinc oxide-based ones, the physical blocks, zinc oxide, that you can put on and you're good to go. And a tint is always better. It gives you better protection.
Okay, good to know. See, this is why you come to her, because she's been doing this a long time. She knows. Hey, Jess, I gotta go.
Okay.
Because I had to treat my melasma today. All right, let's fire this thing up.